So one procedure I've been getting asked about more commonly lately is fat grafting to the breasts. Thought I'd just kind of do a quick video running over the pros and cons of that. They've been gaining a little bit of popularity lately just because people are trying to find ways to get where they want to be without the use of implants. So one of the main pros of doing fat grafting to the breast is the fact that you don't have implants. So you don't have to worry about monitoring the implants or getting them changed out down the road. And so people like that. You're going to have a natural feel to the breast, and it's your own tissue. So whatever, usually in the breast, we count on around 70% survival. So whatever fat survives that first round, then it's there, and you don't have to worry about it anymore. And you'll have it as long as you don't lose weight, or at least not a lot of weight. The other main advantage of it that people like is that there's liposuction involved. So sometimes we have to liposuction more than one area. Generally, one area is included in the facility fee. So sometimes the facility will charge us more if we have to do several areas to get enough fat. Unfortunately, a lot of times people with small breasts are small everywhere else, and it can be difficult to get enough fat. So that having been said, let me go over a couple of the cons. You are limited in the amount of volume that you can get from an augmentation with fat grafting. So it may depend on how much volume you just have on your body that we can access, but it also may depend on how much volume we're able to put into the breast itself. If you don't have a lot of breast tissue, it can be harder to find enough space to put that fat into. So it is possible you may need more than one session, and that may get a little tricky if you don't have enough fat on your body to make that possible. So for some people, it just isn't a reasonable option and isn't doable from that standpoint. So a lot of times we end up using it in conjunction with implants in order to make the breast appear more natural or improve the soft tissue coverage of the implant. The other major con of it is that it can be a fair amount more expensive, even if we're able to get it done in one session, just because there's a lot more involved in doing it. There's the liposuction of one or multiple areas to get the fat, and then there's facility fees involved in all that. There's the operative time, so that increases the anesthesia costs. So all those things can drive up the expense of having fat grafting done to your breast rather than an implant, which tends to be pretty quick and simple for the most part. So that's it in a nutshell. Everybody's a little bit different, so it's hard to make broad statements about these things. But if it's something that you think you might be wanting to discuss, be happy to do so with you. For the month of November, we are offering 10% off on all of our surgeries that are booked before February. So if it's something you've been thinking about, now would be a great time to get in and get it done, and we'd love to see you. Thanks.